We have one approved biologic for lupus, Belimumab. What Belimumab does is it blocks BLyS or BAFF. We do have wonderful long-term safety studies, but the safety studies are also instructive in that they tell us something about durability and efficacy. So the first long-term safety study published was the open label follow-up after the phase 2 and phase 3 clinical trials. And in this 7-year follow-up study, it showed great durability. And in terms of the SLE responder index, the durability was incredibly good. It wasn't that there was any tachyphylaxis. There was reduction in serologies and reduction in prednisone use, and no new safety signals. Now we can go even further than that because we now have the 10-year follow-up study of the patients who are in the phase 2 and phase 3 trials. And again, almost identical data on the durability in terms of the SLE responder index, and even more information on being able to taper prednisone. When the Belimumab studies were first published, the phase 3 trials, there weren't a lot of African American patients in the two phase 3 trials, and there was some question about whether it had benefit in African Americans. Actually, in the phase 2 trial, African Americans did particularly well. But we now have many more data from both investigator initiated and GSK initiated studies that show benefit in African Americans. In particular, we know from an investigator initiated study from the Toronto cohort that comparing patients from the Belimumab trial from similar patients from the Toronto cohort, the patients in the Belimumab trials had less accrual of organ damage. So remember, ultimately, we want many things from new treatments for lupus. We want a reduction in disease activity, but we want a reduction in prednisone and a reduction in organ damage as well. So I think this Toronto study is particularly informative for that reason.